There's two types of nasal valves. There's the internal nasal valve and the external nasal valve. The internal nasal valves are on the inside of the nose, and they form a junction between the septum and the internal cartilages of the nose. The external nasal valve basically refers to the nostrils. Internal nasal valve collapse usually presents as inability to breathe through one side or both sides of your nose. On the outside, you may have what's called an inverted V deformity. That's when the nose is so weak in the middle 2/3 that the cartilages are detached from the bones of the nose. External nasal valve collapse usually presents as nasal airway obstruction, predominantly with deep nasal breathing. Patients might present with pinching of the nose, especially with sleeping or exercising. The faster they breathe through their nose, the more their nose pinches, and the external valves collapse. Other signs that you might have as nasal valve collapse is that your nasal airway obstruction gets better with certain maneuvers. Oftentimes patients will say, I feel better and I can breathe better when I lift up on the skin of my cheeks. The reason that makes you feel better is that it's pulling on the face also pulls open the nasal valve, which is on the side of the nose here, and helps you breathe better. Nasal valve collapse can occur for a lot of different reasons. The number one reason is aging. So a lot of times patients will present with worsening breathing as they get older. And because of the cartilages that have gotten so weak, you have collapse in what we call the mid-vault area, the internal nasal valve area, and you get pinching of the nose. Other causes of nasal valve collapse include patients that have undergone surgery. Anytime you alter the structure of the nose through a prior rhinoplasty, in which you did not address the valve areas, the nose continues to get weaker and you get collapsing of the nose. So prior surgery is also a cause of valve collapse. And another reason that people develop valve collapse is nasal overuse. What we found a lot is in patients that are very athletic, that exercise a lot and use their nose a lot and are chronic nasal breathers. Distance runners, a lot of swimmers, they present with external valve collapse especially. And then it becomes problemsome for them as they get older that they can't breathe or exercise as much. The gold standard treatment of valve collapse is typically through surgery, through an open rhinoplasty approach. Now, these are typically covered by insurance because it does represent a reconstructive procedure to improve your quality of life and your breathing. Hey guys, thanks for watching. Please feel free to subscribe to my YouTube channel for videos on patient procedures and testimonials and a lot more. Click here. How about here?